housekeeping items before we jump into the presentation. We're going to try and keep everybody on mute, but if you do have questions, you can use the raise your hand function or also put your questions into the chat and we're happy to answer them. I will be kicking us off today, and our team can just introduce themselves as they get to their presentation slides. I'm Shannon Ghetto. I'm a project manager at DFSS for the Homeless Services team. I manage the point in time count, so I work pretty closely with All Chicago, our UIC partners, and some other entities that are involved in the PIT year to year, and we appreciate you all being here today. I guess first and foremost, the PIT count is a big undertaking year to year, and we wouldn't be able to do this work without all of our volunteers and having all of you out in the field. So thank you for your willingness to engage and be a participant. I think it's a great opportunity to learn kind of the policy implications and research methods on the ground. And we know it takes a lot to go out from 10 to 3 in the morning on a given night. So we appreciate all the work that you do. This is just a quick overview of the agenda. I probably won't spend too much time on it today, but just going to go over the point in time count overview, some logistics, area assignments and maps, some tips and best practices when out in the field. We'll go through the survey. We'll actually have CDPH joining us since we do have some harm reduction supplies available for teams this year. And then we'll go into some small group engagement just because we know this is a lengthy training. Trying to be mindful and just want you to all be able to discuss and apply some of the learnings that we are showing and introducing to you all today in smaller groups. And then just any questions and follow-up pieces of information that are needed at the end. So in terms of what the point in time count is, so it is an annual one-night count, an estimate of people experiencing homelessness in Chicago. It's mandated by the U.S. Department of Housing and Urban Development, also known as HUD, and it's locally led by DFSS in partnership with All Chicago. The Continuum of Care, also known as our COC, across the country, COCs undertake this important initiative to collect demographic information on service needs of individuals who are experiencing homelessness. And so it's just one of the snapshots and estimates that we have to really capture the unique experiences of individuals and families experiencing homelessness in addition to trends over time. So the data collected is used to inform service delivery as well as resource planning, assist folks who are experiencing homelessness, helps to build public awareness of homelessness, and as I said, track those historical trends as they change over time. As many of you know, the point in time count is scheduled for this upcoming Thursday, so in a week from today on the 25th, and you'll all be participating in the unsheltered aspect of this work. So we'll get into that in a little bit more detail. So components of the PIT, so we have 3 different parts of the point in time count that are kind of taking place at the same time on the same day, but different actually periods of time, excuse me. So we have the unsheltered count, which you are all participating in. It's from 10 p.m. to 3 a.m. We have folks, both trained staff, outreach staff, and volunteers go out into the field and you'll collect data about people experiencing homelessness that you encounter on the night of. For the HUD definition of literal homelessness, that's the target population that we're trying to capture. So that includes anyone that's sleeping in a location that's not meant for human habitation. So sleeping in a park, on a bus, on a train. The CTA is a popular location or a location that unhoused tend to gather, especially in the colder weather, and also at our airports. The outreach teams and volunteers, you'll have assigned areas that you'll count in. So we'll get into more detail about that. And you'll essentially go out and try and engage folks and survey anyone that's willing to consent to the survey. You'll also get a bag of goodies that include warmer socks, hats, hygiene kits, and some harm reduction supplies. So you can give those out to folks that you encounter the night of. And then the 2 other aspects of the count that you won't be as engaged in, but it's just good for your knowledge to know that these are also important components of the work that we're doing the night of. We have a sheltered count that happens from 7 to 10 p.m. Our shelter, transitional housing, and safe haven programs will be doing both surveys as well. It's a very similar survey, but they only do it with a 10% sample of the total residents that they have at their sites the night of the count. And then we will be working with the HMIS team. HMIS stands for the Homeless Management Information System. And that team will be working with us to pull some back-end enrollment data for clients that are staying on site the night of the count to generate our census for shelter count that night. And then finally, one of the things that we've really been working to improve this year is the youth count. The period of time and dates that this takes place is a little bit more flexible than what HUD mandates for the point in time count. So you can see the dates are from the day of the count through that next Tuesday, the 30th. And this is an effort that has really been increased and scaled up this year. We're working with a variety of outreach providers that focus on targeting youth and providing services to them. So drop-in centers, emergency shelters, transitional housing programs. We're partnering with Chicago Public Libraries and some CTA outreach teams as well to make sure that we're capturing their unique experiences. So you may be wondering why all of this matters and the importance of it. So accurate point in time count data and youth count data helps communities in our continuum of care to do a lot of different things, some of which is to understand like the total population and subpopulation trends over time. It allows us to adjust and make sure that we have the relevant types of programs and accessibility to programs available to our clients that need it most. It helps us to justify and advocate for the needs of our community, especially as we've had kind of a shift in our unhoused population pre and post pandemic, and the Chicago being a welcoming city and having migrants and asylum seekers that are here as well. It allows us to comply with reporting requirements from HUD and the federal government, and also just raise public awareness about the issue. And of course, measuring progress as a community towards preventing and ending homelessness, as we do this work together. So typically, these are kind of the entities in the blue bars of who's involved in the main parts of the PIT. So we have the Department of Family and Support Services. That's my team. We oversee both the unsheltered and sheltered parts of the count for the PIT and for the youth count. And then we also are there the night of kind of troubleshooting and making sure that everything is going really smoothly for all the staff and volunteers that are out in the field. We have All Chicago, they're the lead agency of our continuum of care. They'll be helping with the HMIS data portion for the sheltered count and are also on call to help with some of the survey administration or technical issues the night of as well. We have our partners at UIC, the Warrior Center, who are also on this call and will introduce themselves in a moment. They work with us on the methodology to kind of execute the analysis and data cleaning. And then we also have, of course, some of our most important partners, which are our homeless outreach teams and volunteers and our individuals experiencing homelessness and our different advocates in the continuum. So without all of these partners and entities who were actively participating and collaborating with us across the city for the count, this would not be possible. So thank you again. And then we do have some other additional partners that we coordinate on the night of or prior to the count. The Department of Veteran Affairs has a team this year and a bunch of volunteers who are going to be engaging in the count. We work with CPD and the Chicago Transit Authority, the Parks District, Department of Aviation, and of course HUD. So big undertaking for the city. So this slide is really just to give kind of an overview sense of like the key pieces of information of what you will be doing the night of the count. The objective, of course, for all of our outreach providers and volunteers the night of is you'll have teams likely of like 2 to 4 people, and we're hoping that you'll go out to your assigned areas and be able to safely and thoroughly count all individuals that you encounter and experience, all individuals that are experiencing unsheltered homelessness that you encounter in your areas. And you'll either try to engage them and get their consent to do a full survey, or you'll just collect demographic only information, which we'll go through in more detail later into this training. The first step of what you'll do the night of is you will all be assigned host sites that are geographically kind of spaced out around the city. You'll be asked to show up at your host sites around 9 p.m. to check in and get your team assignments and your area assignments and just sign a liability waiver and all these different things. And then starting at 10 p.m. is when all of the unsheltered teams will be able to go out and canvass in your assigned areas. We do ask that teams try to canvass and visit all of their assigned areas at least 2 times. Some teams might finish their canvassing and surveying a little bit early. Some may go past a little bit later than 3 a.m. That's just kind of a rough range of when the unsheltered count is typically conducted. And then, the other part of this, the most important part, is trying to engage individuals who appear to be experiencing homelessness when you go out in your assigned areas. So, as a volunteer with your team, you'll want to make sure that you explain what the purpose of you collecting information about them is for and why you're doing this survey. So, it's to better understand the housing and service needs of people experiencing homelessness in our city and ask if they would like to be surveyed so you can get their consent. And then you can also let them know prior to them consenting that, of course, the survey responses are anonymous. They can stop the question or stop the survey or skip questions at any time as they're moving through the survey, and that all the information that's collected is to really inform programming, policy, and funding for the city in regards to housing and homelessness. And so, kind of based off of your little spiel overview that you give to an individual, they'll either consent to being surveyed, and then you can move into the survey and go through the questions, or of course they may not want to consent, which is also totally fine. Sometimes you'll encounter folks who are also sleeping or just not interested, and so if that's the case, you'll want to make sure that you just answer the demographic questions about them, which we'll review later into the training. So there are options, of course, as you move through. If people want to skip questions, you can say select prefers not to answer, and you can also end the participation of the survey at any time. Finally, after you kind of try to engage them or complete the survey, you'll offer giveaway items. We have some harm reduction supplies, which is new this year, in addition to higher quality winter gloves and just hats and things as well. And then at the very end, after you've canvassed your assigned areas, you'll call your host site, just let them know you've completed your part of the point in time count, and then you can return to your homes for the night. I will say, I know that was also me word vomiting a lot of information, so we will be reviewing that in more detail in some of the slides as we move through. But of course, if you have questions, we can also answer that in the chat or verbally a little bit later into the presentation. So where are we counting? So this map kind of shows an overview of our sampling methodology. So for folks who are involved in research, we use a stratified random sample of our city. We do not do a full census like other COCs or jurisdictions do. And essentially what that means is we have different classifications, as you can see on the left-hand side. We have certainty areas, high density areas, medium density areas, and rare areas. And all of those different groupings have kind of a range of unhoused folks or concentrations that we use to categorize each of the different assigned area census tracts around the city. And based off of the data collection and these hotspots and what groups the census tracts are classified into, we then create kind of this map, color code it, and then randomly select from each of those groups a percentage of the areas that people will survey the night of the count. And so as you can see, for the high areas, the certainty or high density areas, teams will be surveying 100% of those locations, and that includes like CTA, red line and blue line terminus stops. It also includes the central business district, the loop, and some other locations with like larger encampments around the city. And then we survey 85% of those medium density spots and a smaller proportion of the rare areas. Not super important for you to remember this slide. I think it's just kind of helpful context if any of you are interested in the methodology that we've used in the city of Chicago. And essentially we take the results from all these color-coded assigned areas where you'll all be canvassing the night of the count, and we extrapolate or try to expand upon the results from these sampled areas to get a representative view and estimate of the entire city and the folks experiencing homelessness. So I will pause my speaking, and I'm going to turn it over to Maggie from our UIC team to introduce herself, and then also get a little bit more into detail with our maps and resources for you this year.
Great. Thank you, Shannon. My name is Maggie Schaefer. I am a research specialist at UIC at the UIC Voorhees Center. And just diving into the maps that we will be providing to kind of assist you throughout the night of the count. First of all, we will be providing physical map packets of all of the areas that we would like, or that you will be canvassing. So these map packets will include boundaries of the areas. It will also include known hotspots, so places that we have historically seen large groups of individuals. It includes parks, hospitals, police stations, fire stations, and CTA rail stations. One thing to note is that teams will likely encounter areas that are either uninhabited or uninhabitable or have a particular concentration. And when it comes to this, we just advise that you consult or use your local knowledge and expertise. So in addition to these physical map packets, if you could go to the next slide, please. We will be providing some maps that can be added to your Google Map app. So each outreach team will be provided with a map. We will be sending out links to these maps likely on Friday. And they will include all of the tracks and areas that that each outreach team has been assigned. So one thing to point out with these Google Maps is that you will need to have the Google Maps app on your phone downloaded. On Androids, the link should automatically open in your Google Maps. However, on iPhones, it will give an option on how to open, and we specify, or how to open, and we advise that you specify to open it in the default app, which will pull the map up in the Google Map. I will be giving a short presentation or demonstration of how to use this. However, before I go into that, I want to point out that on these maps, you can manually zoom into the area that you have been assigned. However, you cannot search it in the search bar. So however, you are able to search it if you are to pull up the map link that we send you in a browser on a computer. You will be able to just search, say you've been assigned to track number 53, you'll be able to search track number 53 just to get an idea of the area that map is, or that tract or area is in. So with that, I'm going to switch over to my phone and give you a quick demonstration of how this map will look on your phone.
Maggie, you're muted.
Thank you. Sorry about that. So one thing to note is that these maps might look slightly different on your phones. I'm using an Android. We will have a user guide sent out on Friday that will kind of troubleshoot any issues that will come up. But just for now, I'm going to show you how this looks on my phone so you can get an idea of how it works. So here we have, this is the map for Thresholds, the Thresholds outreach team. Of course, if you are working with a different outreach team, you will have a different map of tracks that have been assigned. But you can just simply zoom into, whatever track you've been assigned here and click on it. Here you can see this is track number 46. So you can get a little more information. Here you see the certainty of it. So as Shannon had gone over, we had those different kind of classifications of different census tracts. So this will just give you an idea of how historically, how many individuals have been counted in this tract. So this specific tract has historically seen over 30 people in it. You can also view the map legend and see kind of what these points of interest mean. They're similar to the printed map, but you can just get an idea of what each icon means. One thing to point out when you are pulling up this legend is if you press the close button here on the upper right-hand corner, it will close out the map completely, which obviously we do not want to have happen. So just go back versus closing it out, and that will take you to the original map. You can also click on these points of interest to get a little more details. So here we have the Chicago Lakeshore Hospital, which is a hospital, and you have the address to it. You can also navigate to this address, which will help you get there faster. Obviously, I am down here at the UIC building, but when you are in the census tract, you can also see where you physically are, just as you usually would with the Google Maps app, to help you navigate around. So that is the map. That's a quick overview of the maps. Like I said, we'll be sending out a user guide as well as links to specific outreach teams' maps. And that user guide will be using a Google Drive document. So we will have FAQs that we have come up with. However, if you find yourself having some issues before the day of the pit count, please just write your questions in that Google Drive app, and we'll be sure to take a look at that and answer them for you.
So maybe
Great.
we'll pause for a moment. Thank you, Juan. The UIC team worked hard we got some feedback last year that having a map that helped orient people by location in their assigned areas was something to try out. So this was a great new addition thanks to the UIC team. But I do want to pause for a moment to see if anyone has any questions around the Google Map resource. We'll send those links out, of course, later, or the map packets, which will be something you'll receive the night of the count. We're going to be sharing it with your host sites, and then the host sites assign the map or assigned areas that you will be surveying and canvassing in. But if anyone has any questions about like how to utilize these tools or just like the actual packet and orientation of the paper map one on the previous slide, we're happy to answer any questions. I'm going to take no questions as a good sign. Oh, wait. How will we be getting to the location? So folks will be responsible to getting to your host sites on your own. So the 9 p.m. meet at your host site is something that you'll all have to coordinate individually. And then you will be grouped by the host sites based on which volunteers or staff have access to cars. And so if you don't have a car and you indicated that obviously in your survey, your volunteer registration survey, that's totally okay. We have enough ratios of at least one person per group to have a car, and then they'll be driving you around the night of to your assigned areas. All right. So CTA is specific to the teams. So the only team that will have volunteers that need to coordinate is the night ministry. And so we'll let the night ministry team follow up with those volunteers once they've been finalized and selected. All righty, we can keep going and I'll respond to questions in the chat as we move through. So I think up next is Sarah. Thank you, Maggie.
Thank you.
All right. So my name is Sarah Valek. I'm a program analyst over here at DFSS. If you've done the PIT before, you've heard my voice before. So we will get through my part of the training this year. So preparing for the count. It is pretty similar, but there are slight differences for volunteers or outreach teams. So the week before the count, which is this week, which is wild, volunteers are attending the online pit count training today. So thank you for being here with us. And then you'll receive your assigned host site information by the end of the day tomorrow, Friday the 20th. I will send you an email. It will have your host site's contact person CC'd on it so that you can communicate with them if necessary. And it will include all of the information about where you need to be at 9 p.m. on the night of the count, the address, the best phone number for them, anything like that. So that will come out tomorrow. For outreach teams, similarly, thank you for attending the training today with us, and all of the outreach team leads will be emailed area assignments by the end of tomorrow so that they can start to divvy those up and kind of communicate to you as their team what is needed of you on the night of the count. For the week of the count next week, the volunteers, you will receive a final reminder email with your host site, important information, and the survey link for the count. And that will come out on the afternoon of the count, just kind of so it is at the top of your inbox. Outreach team leads will be coordinating with DFSS next week to pick up the giveaway items for all their teams. we will be doing that on the 24th, so Wednesday, and then they'll use the map packets to plan out the area and team assignments for their volunteer and outreach teams. We will also email you with a survey link pre-count so that it's at the top of your inboxes as well. And then the night of the count on the 25th, the volunteers will report to their assigned host sites to pick up their supplies, check in, receive their area assignments, and convene with the teams that they will be working with for the night. Outreach team members that are not affiliated with host sites do not need to report to a host site on the night of the count. If you are affiliated with a host site, you should report to the site unless told otherwise by your team lead. If you are an outreach team member or team lead and you have any questions on that, please do not hesitate to reach out to me. So night of the count logistics, kind of just what we went over, but just in a little bit more detail for the night of the count. At 9 p.m. on the night of the count, volunteers and outreach teams that are kind of part of a host site will arrive at the host location. 9 to 9:20 will generally be check-in and signing kind of your liability forms. 9:20 to 9:50 will be receiving your area assignments and team assignments from your host site lead, having a little bit of time for questions to be answered or training refreshers to happen as needed. And then 9:50 to 10, staff and volunteers will be sent out to complete the pick count. And so once the count is completed on the night of the count, you'll also contact your host site lead. We'll give you their phone numbers so that you can let them know that you are done for the night as a team, just so that we can keep track of everyone. For outreach teams that are without a host site, you can begin counting at 10 p.m. And then similarly, please do make sure to report to DFSS when you're completed, have completed your section of the count for the night of. And some tips for planning your route and canvassing on the night of the count. We ask that you make sure to visit all of your assigned locations for your team, but to allocate your time based where you are kind of most likely to see individuals. You'll spend more time in the tracks that are considered high or medium areas than the rare or low ones most likely. And we do ask that you cover each assigned area at least 2 times. So kind of going through and then going through a second time, not counting the same people, but looking to see if there's any new people that have come into that area. Along with your scan of unsheltered locations, you should also visit hotspots. Hotspots will be indicated on your map as Maggie was showing with kind of a variety of different icons, which will have a legend on your map. Generally, hotspots include things like hospitals, police stations, parks, encampments, just areas that we know from local data and expertise that there are likely to be people on the night of the count that you might need to counter survey. In planning your route, we recommend starting with those higher certainty areas and then maybe moving to medium or rare areas. We also think that it is beneficial to think about where your hotspots are and what type of hotspots they are, and making sure that the routes make sense from a geographic standpoint. So with that, kind of thinking about if you have an encampment hotspot, the likelihood that someone that is sleeping outside on a cold night might not want to come out to talk to you later in the night, if they are willing to talk to you at all, is pretty high. So going there maybe earlier in the night than going to a hospital hotspot, for example, where it's indoors and there's a little bit more of a likelihood that someone might be kind of awake or willing to talk inside. But for all the areas, we do ask if you see someone but don't feel comfortable entering a space or approaching, you do count them by observation using the demographic questions, as we will go over still. And we ask that you please do not cross any barriers or fences to reach individuals. If there are individuals you can see that you still would like to count, but you cannot kind of reach them to talk to them and survey them, you can count the individuals by observation if that is possible. We do again recommend visiting your hotspots identified in the map packet kind of multiple times, at least 2 throughout the night, as people might move around, especially in those spaces. And if it's getting late and you're worried about covering your entire assigned area, we do ask that you potentially switch to answering only demographic tally questions by observation so that you can still complete all of your areas on the night of the count by 3 a.m. Now we have some tips for identifying individuals who are experiencing homelessness. As many of you know, the experience of homelessness can look very vastly different from person to person. and it is not something that you always can or even commonly can tell just by observation necessarily. These are just a couple of tips for identifying individuals that we kind of collected from a variety of providers to give you a little bit of advice, knowing that, again, it's not a necessarily perfect measure for understanding if someone might be experiencing homelessness. But if in doubt about whether an individual might be experiencing homelessness, remember to ask in a respectful and appropriate manner if you are going to talk to them. You could kind of broach the topic by saying something like, hey, we're volunteers out surveying individuals tonight to better understand the housing and service needs of those experiencing homelessness in Chicago. Would you happen to be willing to answer a few questions? Something like that might imply, but not directly indicate, that that person themselves are the one experiencing homelessness initially, and then that could be confirmed or denied through the survey and their responses to you. Possible observable signs that an individual may be experiencing homelessness might be if an individual is kind of sleeping outdoors in a park or in an kind of abandoned in or near an abandoned building, staying at a bus or CTA stop or park for an extended time. So maybe you drive by the first time and notice someone, but you're not entirely certain. And then on your second drive by 45 minutes later or something like that, they're still in that location, kind of that amount of time later on a cold night. It might indicate that an individual could be experiencing homelessness. If someone's carrying a large quantity of bags or other items with them, or if they have clothing or bags that might be a little bit more worn or in some disrepair, if an individual might be asking for money or other items, or again, none of the above. Again, the experience is very different and doesn't really have a specific look. We know that it can be very difficult to identify individuals and whether or not they're experiencing homelessness, but we just ask that you try your best to distinguish who may or may not be experiencing homelessness through both surveys and observation on the night of the count. As an important note too, for volunteers who might not have as much experience and might be a little bit concerned about their ability to do this, you will be in groups with experienced homeless outreach staff members who have a little bit more experience in maybe identifying or engaging individuals who might be in unsheltered locations. So they will be there to kind of assist you with this as well. And so then we're going to move into just a couple of best practices for different types of hotspot locations. So unsheltered street locations that your team should visit and count within include outside, staying on the street. So anyone you might see walking or hanging out along the street, or potentially panhandling on the street or sidewalk while you are scanning your various areas. Near highways or under viaducts, sometimes encampments can be along the side of a highway entrance or exit, so keep an eye out for those. And sometimes individuals might not be in your immediate view under viaducts. Kind of be sure to look up and around your viaduct as possible. And then in the parks in your area, sometimes your team might need to leave the car to check out areas of the park thoroughly on foot, especially in larger park areas. We do ask that you do this if you're comfortable and that your team sticks together and doesn't split up or kind of wander away from each other if you are doing portions of maybe a park or larger area on foot. Another set of best practices are for kind of temporary locations. So in police departments or hospital waiting rooms of your assigned area, individuals seeking shelter can go to police departments, and sometimes they go to hospitals for assistance seeking shelter. We do recommend that you enter these spaces, especially if they're indicated as hotspots on your map packet, and that you maybe ask the front desk person in a space if anyone might be seeking shelter or experiencing homelessness. You can also kind of look around to see if there's anyone that you might be able to see inside that might be experiencing homelessness. You can count these individuals either by observation if they don't necessarily want to engage or they're sleeping or anything like that, or you can offer to survey them if they seem like they might be interested. Another temporary location is kind of 24-hour or late night establishments in your area. This can include things like fast food restaurants or kind of convenience stores that you might see people either gathering outside of, or that kind of outreach teams might know or have indicated in hotspots that there's a likelihood of people being in. We recommend that if comfortable, your team does enter these establishments to kind of look around and see if there are any indicators that anyone in the space might be experiencing homelessness, kind of like the ones we were discussing already. If possible, you can discreetly ask an employee as well if anyone typically hangs out in the location that has kind of a lot of belongings or is there for an extended period of time or might be experiencing homelessness, as sometimes in these spaces, employees might get to know people a little bit more and might be able to assist you. And then kind of best practices for bus stops or CTA stations. At bus stops or outside of CTA terminals for kind of the L. If someone is at a bus stop and you're unsure about whether they might be experiencing homelessness, again, we recommend potentially circling around later in the evening on kind of your second pass of your area to see if they're still there, which might indicate a little bit more of a likelihood that they might be experiencing homelessness, dependent on how long they've kind of been waiting outside. And then if someone is outside the turnstiles of a CTA station, so outside of the station or in the lobby of the station, if you see someone, you can count them by survey or observation. We ask that you do not count those that are accessing or on the trains, as we do have other teams doing that. For bus terminuses, if there's a bus terminus station in your assigned area, we do ask that you try to visit that at least 2 times during the count. A bus terminus is going to be one of the end stations of a bus line, so it's going to be where there might be a little bit more likelihood of people hanging out or where a bus might stop for a little bit longer than your general bus kind of stop. And so if you do visit one of these, we do ask that you count anyone at the stop throughout the night, either through surveying or by observation, trying not to double count anyone as possible, and that if a bus is at a terminal stop or stopped for a longer period of time, you can step onto the bus and kind of let the driver know that you're with the city's point in time count of people experiencing homelessness if you're comfortable doing so. And you can ask if there's anyone who has been kind of continuously riding the bus, and if they indicate that someone has been, or if you see someone who might be experiencing homelessness, you can count them using kind of the observation only questions and exit the bus. Because the buses are moving a little bit more quickly and not necessarily stopped as long, we do ask that you don't necessarily try to survey individuals just to not hold up the bus. And then for what I think might be my final slide or close to it, the counting encampments and tents slide. We wanted to provide some best practices on this, as we know it has been a kind of large portion of the count previously. Unfortunately, HUD does not allow tents or built structures to be counted as individuals during the pit unless you can confirm that someone is inside them. So some of the things that we've discussed with them for counting at encampments or tents during the count is that if it is before 12:30 a.m., so kind of between 10 to 12:30 a.m., we ask that you do announce your presence at an encampment or tent to see if someone is willing to engage with you. We ask that you do this in like a very respectful manner and at kind of a moderate voice level, not like shouting at anyone necessarily, but just kind of indicating like, again, hi, we're volunteers. We are participating in the city's point in time count, collecting information about individuals experiencing homelessness and kind of their service and housing needs. Would anybody be willing to kind of participate in a survey or answer a few questions tonight? And just seeing if there's anyone interested in kind of coming out to participate. If there are people outside the tents are willing to talk on site, or if they do come out after you kind of identify yourself at the site, you can ask them for confirmation that the tents on site are occupied and the demographics of those that occupy them. So you can complete a survey with this individual, and then if they can give you demographic information about other individuals that are on site, but potentially don't want to come out of their tents, then you can kind of interact with this individual to collect the demographic information for those other people who might not be willing to engage with you at that time. If individuals are visible on site but not willing to interact with you, we do ask that you count them using the observation only demographic questions to the best of your ability. And then if no one's visible on site at an encampment or tent and no one responds when you announce your presence to them, you do unfortunately have to move on without counting anyone at that location. However, if there is a specific location that you lack confidence in your count for, or are like a little bit nervous about and would like kind of basically us to double check, you can make a note of this and email us at homelesscount@cityofchicago.org to flag the location as one that might need to be checked against local data post-count. We have a variety of data from kind of our outreach teams and other providers that we can use to see what sort of the reality of the site might be, if there's a little bit of concern there. All right, and then the last thing I'll kind of speak to quickly is the data collection instrument. So on the night of the pit, we do count individuals in one of two ways, and that is by completing the full survey or completing the demographic questions only. Both of these are done through an online link. We used to use paper surveys and tally sheets. We have now, since COVID, moved to an online tool. We have printed versions that are available if people prefer that, but we do ask that all of the information ends up in the online survey. So it is a little bit easier to utilize that if possible. And again, that link will be emailed to you prior to the count. But basically, if an individual experiencing homelessness in your area consents to being surveyed, we ask that you complete the full survey. If in the midst of doing that, the individual decides they no longer want to participate or they don't want to answer certain questions or anything like that, that is totally fine. There are options for prefer not to answer for the questions if they just want to skip some of them, or if they decide at some point in the survey that they do not want to continue the survey, it is okay. Finish the survey to where you are and submit that, but you do not force anyone to continue on if they do not want to. On the other hand, if an individual is not interested in completing a full survey or doesn't want to engage with you, or is maybe sleeping or kind of off in a way that you can't necessarily reach them and can only really be counted by observation, we do ask you complete the demographic questions only to the best of your ability by observation. And so with that, I am going to turn it over to Sienna from All Chicago, who's going to talk a little bit about the survey itself and give you guys kind of a walkthrough of that.
Thanks, Sarah. Hi, everyone. I'm Sienna Vietti. I'm a program coordinator at All Chicago. And along with DFSS, we have created this survey for you all to use on the night of. It's very similar to last year, some tweaks. So this is the start of the survey. Well, there's a first page that will go over just your information that you fill out, your phone number, name, your census tract number, and then this will pop up, which will be what you will read to someone if they're willing to participate. So I'll show you that more in depth when I share my screen. You can go to the next slide, please. Thank you. So this first part is basically what will happen if you're going to do it by observation or they decline when you ask them if they're willing to take the survey. So this will probably be like a common way that you will be answering. So say they say no, it will stop the survey once you press next, and this demographic information just below will pop up on your screen. And so just to be clear, it will show by observation because it's just a part of the logic that will show on your screen. To basically, after you answer these three questions, it will and you press next, it will finalize the response. So you basically let's see, so you estimate the age of the individual. You can check multiple boxes this year for responses. I know with observation you probably won't do that. You'll probably just do your best guess of someone's gender and then as well as their race, ethnicity. So you just can click, or if you don't feel comfortable, you can always say don't know or prefer not to respond. And that will finalize that part of the survey if it's just demographics that you're answering. And then I think the next slide, it would just be me. Oh yeah, this just shows the final page. And the nice thing about it is instead of having to like keep opening the survey, you can just press that thing that says click this link, and then it will take you to a new response that you can fill out. And there's also, if they do complete the survey, you can also read that little blurb below that says, these are all the questions we have for you tonight, that whole blurb. So that is that part. And then I guess once, Shannon, or I don't know if you're sharing screen, but I can share mine now. Thank you. Okay. So now I'm going to go over this. Okay, so hopefully you all can see my screen. This is a test of a survey. So it's nice and outcome where I can kind of just go through and see what it will look like on that night. And so right here, I have it in a mobile view, just because most of you will be on a phone, I assume, tonight or that night. So basically, this will be the first thing you see when you open the link, and you'll just put your assigned location, and it will just click next. You might have to press next automatically. The nice thing is also you can go back if you don't like your response. You can't change the survey once you start it, like it will just submit, but you can go back if you want to change an answer. And so you can put additional information here if you want to, beyond just the census tract number. But you also here, if you don't mind, I'll send out this link or put it in the chat for you all if you want to practice. But please put test here just so we know it's not a real response, especially the day of. It's nice to have that there so we can know what to delete. But yeah, this will be open for you all to practice if you're wanting to. And then you can put your name here, just put mine. So that's yours, not the individual you're surveying. And then here's the format we're hoping for. It is all formatted so that you have to put it in this kind of rhythm here with the 12 characters. So just put your phone number. So it's basically if we have questions about something you submitted, we can find you, reach out to you. So then this starts the survey. So here's what I was mentioning before, how to start, how to introduce yourself, the reminders, and then also just the script if you're wanting to use that and that's more comfortable for you. So then you'll just press next. Okay, so here is where there's a difference. So you either can press no, which will send you to demographic questions, and if you're doing that by observation, or you can press yes. So I'll show you a yes. So the first question is about experiencing homelessness. And this is also to flag if they aren't, this will end the survey, which we won't do that. If they are, that will continue on. Don't know, it will still continue. And then there's a prefer not to answer, which will also continue on. But most people at this point will probably say yes. And then this is the question that will flag for people that are seeking asylum. And so if you press yes here, there will be an option for where the country they're from, or no, which will just take you to the next question. So there's all conditional logic, which means like you can go back if you make a mistake, just here. Okay, and then where are you going to stay tonight? So these are questions where if someone owns a place, that's another flag. Oh, okay, they're not experiencing homelessness. So that will end the survey once you press that and press next. But let's say this person said that they're on the street or outside. And then this next question will pop up pertaining to outside or street choices. And let's say you found them in an abandoned building. And then have they already completed a survey tonight? This kind of also flags if it's something that where they've already taken, like most likely it's probably a PIT survey they've taken. So that will also kind of prevent double counting. But let's say they have not. This will continue. And now you get the demographic questions where you're able to ask them. So it's not observational. So you can read this little script to them. Anything that's that's italicized, we try to make it more of a script for you all. So and if it's in quotes, you don't have to read it. It's just if you want to. Okay. And then you can put their initials here. I will put mine. So that's when you can ask. And if they don't want to respond, I believe you should be able to put like NA or something. But yeah, unfortunately, you can't leave that blank. And then this part, you can put in their birthday. It's nice. I think last year we didn't have this, and I think people struggled by using this little calendar tool, which you can like put in years, and like it's kind of lengthy. So I would recommend, if you can, just put in it manually, and it's already kind of set up for you, which is nice. So that's how I would do it. And then this is a question that you can't answer if the date of birth is not, if they either don't answer or you just want to estimate it, which you could put both, but yeah. Okay. And then, so this is again, just to remind you, you can click multiple answers just to be more, just to have more inclusion this year. And so I'll just click the one and then keep going. Same thing with race, you can click multiple. Here are all the options, and always prefer not to answer is an option. Okay, and then now we're gonna it asks about serving in the armed forces, which is all these above. And then there's also some context here if you do interact with a veteran. So let's say yes, just so I can show you all these questions that come up. So again, multiple choice, you click, keep it going. Again, there's questions that will pop up based on what you're responding. And this logic's all should be good. But if you do notice something's kind of off with the survey, please email either like the DFSS team or myself, and I can put my email in the chat, because we want to flag this before it actually goes out to everyone and it's ready to go for 10 p.m. on the 25th. So definitely like let us know. Okay, so this is about family. So this is a couple questions that will pop up if they do have children. So I'll show you just so you can see. So how many kids you have with you. You're gonna put in a number. Let's just say it's 1. And again, you can press no or none or don't know or prefer not to answer, and all the logic will hopefully work out. And this is also just if you do see minors if you can't counter a family with minors, this is a number you can call, which is DFSS. And then here's where you can put in the age. So let's say they have a 5-year-old. You can leave the rest of them blank, of course. Just put in the 1 since you answered 1. And then again, you can pick multiple genders. Let's say it's a girl. And so I guess in the phone, it seems like it will prompt you through all of, let's see. Yeah, unfortunately, I think with the phone, it like puts it on each page. So you will have to click through, but it won't make you answer all of them. I can look into see if there's a way we can fix that. But anyways, I'll just click through. And then the last set of questions should be about homelessness. And so this is like, again, something that's quotes where you can read it to them. And they have the option to not respond to these questions, of course. So if let's say this is their first time, they've experienced it for 1 to 3 months, and I'm just going through quickly, but you all can, of course, look through this at your own time. Let's say 1 time. And then this is like in total, how many times have you experienced homelessness in the last 3 years? I'll just say that. And then these are reasons that they are experiencing homelessness. So they can, again, pick with the checkbox, you can pick multiple. So I'll just say this, but you can pick more. And then and then another question basically about benefits for disorders. And then about employment. And then fleeing domestic violence. And then shelter care. Sorry, there's just a lot of questions here. And then, have you ever been to jail? Yes. Okay, so that's the last question. This will be the thank you page. Now you'll see it like how it looks on, a mobile phone. And then again, this link will take you back to the top. Okay, now it's showing all 4 questions on the same page. So I don't know. I think it will kind of vary on each phone and each device. But just to let you know, that's just so you're aware. It might look different depending on what phone you have, maybe how big your screen is. But all the questions will be there. It just may be different screens that you're seeing or different pages. But yeah, I will put the link so you all can practice. Like I said, please put test in there so we know, and I will delete all those test responses. So no worries. Like if you want to send a bunch in, we won't count them, of course. Shannon, let me stop.
Yeah, hold on a second. Sienna, I might have you keep that page up. So there's some questions
Sure.
specifically around survey administration and just like the survey. So there was a question about what if they want to survey on their own using our phone. So the recommendation, it's your phone. So if you want to let others use your phone, I think that's okay. But we do recommend, it is the best practices as the survey administrator. If they consent to participating in the survey, you should be reading them the questions and the responses. If you want to be next to them, obviously like as close as you both feel comfortable, you can have, your phone up and you can read through the questions together. That might make it a little bit faster than just like verbally reading everything, letting them read along with you. So I think that would be the best practice guidance. It's your phone, so it's your decision at the end of the day. But as the administrator, that is kind of the way in which we've structured this, to have the questions read and then just have them respond. So it takes some of the burden off of the survey respondent. And then wondering if there's a button to stop the survey in case someone doesn't want to finish the survey, Sienna.
Not necessarily. I mean, I guess you could click out of the survey and like refresh it. Or another option would just be, like I said, like in certain questions, there's always a chance where you can press that they are experiencing homelessness, which will discount the count. So maybe they are, say they're, well, sorry. So basically it would be demographic, right? It would be a demographic only kind of thing. If they're experiencing homelessness, Shannon, the question is, but they're not wanting to participate anymore with the actual
Yeah, if they
full
don't want
survey.
to, they can stop the survey at any time. And from my understanding, they can just, you can exit out of that survey screen. And then when you start a new survey, click on the link again to open up a new browser. It will collect the information for the questions that you get through anyways on the back end. And that should be the end of it from what I have known historically. Sienna, is that right?
Yeah, that sounds right. I mean, if anything, if it's an incomplete survey, I think it will be something that on the back end of the data, we would just delete, but try not to do that because then it's kind of confusing. So, but if they do at any time want to stop, you can stop the survey, of course.
Yeah.
So, yeah.
There was a great question from someone, Michelle. Hi, Michelle. If we're supposed to call those phone numbers in the middle of the interview for vets and families and children. And I actually have a slide to reiterate that information next, so I can kind of speak to that in more detail and the protocols surrounding that. And then there was another question as you started this. Someone was confused when to actually administer the survey versus just doing the tally with the demographic information. So just to reiterate, when you open the survey link, and I don't know, Sienna, oh, this is it. So you fill in these questions, obviously, about your location, interviewer contact information, and name, and then you ask if they consent to the survey. If they do not consent, you click no. I don't know, Sienna, if you can fill that in super
Yeah, I
quickly
can pull it
to
up
demo
again.
it, please. Thank you. And you'll put that this is a test in the location option, obviously. Go through the script. So this is where that initial change happens to either continue with the survey or to just do the observational demographic questions, Taylor. So if they say that they do not consent to the survey and don't want to participate or be bothered, you select no, click next, and then it takes you to the demographic information questions. And you can just try to complete this to the best of your ability based on if you're able to visually see the person. If they're in a tent, for example, and they don't come out, some of this you may not be able to fully capture, and just try to do the best that you can with the information that is provided. There's also options for don't know or respondent didn't prefer not to answer. So use your knowledge and the situation to answer these as best as you can. Does that make sense? And hopefully this is clarified for others who may have been unsure. Okay, so yes, hi Cynthia, we'll get to the veteran piece in a moment. If they have children and reading part about calling a number, will they be scared? Okay, let's go to the next slide. And Sarah, if I'm missing a few of these questions, I'll let you answer them as we move through this. Good questions though. And I will say the training is scheduled to go up until 4 p.m. I know some folks had been messaging me about this. We're anticipating that it will hopefully end a little bit earlier than that, but just wanted to let you all know that that was kind of the estimated amount of time. Okay, so, oh, Sienna, I think this is actually yours, but I can take it if you want. You just want to, if you make a mistake, you can select the back button option as she previewed for you on the previous page. There's a conditional logic to a lot of the questions. So if they select yes to being a veteran, it asks them some questions around their history of being a vet. Starred questions mean that they're mandatory or required and cannot be skipped. So you need to select don't know or they prefer not to answer if you don't get information about that question or they want to skip it. And then if you accidentally, I'm going to mute. Okay, they got muted. Thank you. If you accidentally exit out of the survey or submit it too soon, there's no way to return back to the survey. So just be careful about exiting out while you're toggling between questions and pages. And then you'll need to begin a new survey and make a note that it's an incorrect survey if it's a duplicate entry to get to the place where you accidentally exited out. If you encounter an issue with the survey the night of or need assistance, you can contact Sienna. That's her line from All Chicago to have assistance. And And then that is the way that you can let us know that there was an incorrect survey in the time that you sent it or the location as an example and flag. And then if you're previewing the survey, just to reiterate, you want to put test in that location question on the first page. Just want to make sure folks feel like they, oh yeah, so Michelle, I think we answered your question about the incorrect survey. I want to call us at that number and let us know. And Tiana, yes, thank you for the walkthrough. So surrounding specific populations that you may encounter while surveying. So of course, veterans, we have our great VA team who are partnering with us on this initiative, the Night of the Count. You can contact Lucia Spinelli at that specific number. You don't have to write that down right now. We will have all of these important numbers for these subpopulations available to all of you on like a cheat sheet. So you'll each receive a cheat sheet with all of these numbers and important information to be reiterated the night of the count at your host sites, and you'll review it with your host sites before going out into the field. So if you encounter a veteran as you're getting through those veteran questions, at the end of the survey, I think for all of these examples, if you encounter someone that meets one of these scenarios, you don't want to disrupt and create, you don't want to re-traumatize anyone. You want to make sure that this is, something that it remains calm. And so just make sure that you can get through the survey questions, and then at the end of the survey is when you would want to make the call to the appropriate contact on your cheat sheet. So for veterans, it would be Lucia, and then Lucia will be working with VA staff to confirm eligibility and help folks get transferred to shelter. And then we'll have another contact for Christina Moldova from the VA as well on your cheat sheets, and she's available to connect people to additional resources. Maybe someone doesn't want shelter that specific night, but they are interested in housing opportunities or other resources through the VA. So we'll have 2 numbers for you available. For unsheltered families with minor children, so children under the age of 18 the night of the count, this doesn't happen very frequently, but occasionally there are unsheltered families with minor children that are encountered. And if the family is willing to get through the survey, at the end of the survey is when you would immediately call DFSS and report that situation. And because it's, from a legal perspective, we have to follow protocols as mandated reporters. Children are not supposed to be in unsheltered locations, especially in the winter when temperatures can be colder. And so that is something that we are all mandated to do if you do encounter this situation. I know there was a question about that at some point in the chat. And DFSS will do our best to immediately get that family transferred and assisted if they are interested in shelter placement, of course, because we want to make sure that they have the connection and all the options available. So we will be working at our command center. You can call us, and then if the family is interested in accessing shelter, we can work with them on that. Or if there's another situation that arises, we can also support and contact the appropriate entities. And then for new arrivals, asylum seekers, and migrants, there are a few questions in the survey, as Sienna said, that deal with capturing some information about the new arrival population. And if there's an individual or a head of household for a family that's interested in completing the survey, but you don't have a team member that speaks Spanish, you can just collect the demographic information. We're trying to see if we can get some language support, translation support at our command center as well. So if we have any updates around that, we'll include a phone number to access some of that support. But hopefully you'll have a member of your team out in the field who does speak Spanish and can help with that survey administration in Spanish as well. And then if there is an individual or family seeking shelter at the location as well, you can point them to the nearest police station or hospital to place the 311 shelter call. I will say if there are families or individuals that are seeking shelter during the point in time count, we're working right now to communicate with our centralized intake partner, Salvation Army and 311, to ensure that shelter requests that are done at 10 p.m., so starting when the unsheltered count happens, that the requests that come through from 311 for individuals found in unsheltered locations during the count are prioritized. So that's something that we're trying to coordinate on right now to make sure that that is ready to go. But if you have any other questions about that, you can let us know or follow up with us, and you'll all be matched with at least one trained homeless outreach provider in your groups. And so I think working with them, they know best practices and have expertise around how to navigate a lot of these situations. So just keep that in mind. Okay, we're going to keep going through. We'll answer the questions in the chat. So next we have a special partner here from CDPH. I was messing up my acronym. So Madeline, I'll turn it over to you in a moment. So if we go to the next slide. Oh, there's one other, I guess there's this slide. I'll go over this too, and then I'll turn it over to Madeline in terms of some of the other items on the agenda. But just to reiterate some of the supplies or things that will be important for all of you to bring the night of the count. You'll want to have your own cell phone fully charged or a tablet. Computers are a little bulky and probably hard to use when you're out in the field. So I think cell phone is usually the easiest and best practice. We will have backup hard copies of the Unsheltered survey in English and Spanish available for all of the host sites and teams. So if someone prefers to do a paper survey, that's totally fine. If you use the paper printed version, you just want to make sure that at a later point when you're like moving between locations, that you enter that information or have a team member enter that information into the online version of the survey tool. You'll want to make sure that there's a phone or car charger for phones that other people in your team can access. You want to make sure that you layer up. It's not supposed to be as cold next week as it has been in the last week and a half, which is good news for the pit. But you'll still want to wear weather appropriate clothing. Make sure you have layers. We'll have some hand warmers in the bags that teams can use as needed. And then in addition, your outreach team leads and host sites will provide you with those cheat sheets that I mentioned, hand or paper and digital copies of your map assignments, and then the giveaway items. I know someone was asking if we'll have supplies to give out. This is the list of supplies that you will have access to give to those you encounter the night of. Okay, next slide. So safety precautions, this is something that we always just like to spend a little bit of time on. So we're coordinating with CDPH. They're aware of the pit. They know that volunteers will be out in the field. You'll have at least one person on your teams who will have these little like point in time count fun lanyard souvenirs that you can keep. We, of course, have protocols around police. So if there's an emergency, always please call 911. We never want you to feel uncomfortable or unsafe at any point during your experience with the point in time count. So it's okay to stop serving someone or leave a location immediately with your team if something comes up or you do not feel safe. You do not want to follow or to wander away from your team at any point during the point in time count as well. Don't leave your car running and unoccupied while you're outside engaging with folks during the point in time count. Also, do not cross barriers or fences. We don't recommend going into abandoned buildings. I know that was an option in the survey, but we don't recommend going into areas that have barriers or where you don't have a lot of knowledge or visibility. We want people to remain safe physically and emotionally and all the things. So a lot of this, I think, is common sense, but just to remember, you will have your outreach teams kind of guiding you throughout the night. And so if you have any follow-up questions around safety plans or information, please let us know. All right, now we're to the harm reduction part. So I will go ahead and turn this over to CDPH to introduce themselves and give a little bit of an overview of some of the new supplies that we have available for teams this year.
And so it's a super question.
Hi, good afternoon. Can you hear me?
We can.
Perfect. Hi, I'm Madeline Saldon. I am in the Office of Substance Use. So we supplied DFSS with Narcan, fentanyl test strips, and xylazine test strips. So that will be available for you guys to hand out for people who are interested in having these supplies with them. Next slide, please. Perfect. So now for our harm reduction training. Next slide. So what is an opioid? Opioids are a type of drug used to temporarily reduce pain. So what happens chemically is that whenever a person takes an opioid or a drug that has opioid in it, opioid receptors in the brain, or they attach to opioid receptors in the brain, causing cells to release signals of reduced pain and increased pleasure. And at high doses, sometimes it affects people's breathing. Opioids are legally prescribed and looks like oxycodone, hydrocodone, morphine, and codeine, even fentanyl. Opioids are illegally manufactured and sold as heroin, fentanyl, and carfentanil. So fentanyl is both prescribed illegally and is also illegally made. Next slide, please. So you can overdose on various types of substances. So you can overdose on alcohol, Tylenol, or a mixture of different substances. All of those overdoses look completely different than an opioid overdose. So an opioid overdose is when too many opioids flood the brain, overwhelming the opioid receptors and causing a person to stop breathing. So some signs of an opioid overdose are pinpoint pupils, unconsciousness, slow and shallow breathing, pale or ashy skin, blue lips, and a snoring or raspy breath. Since it is the winter time, I try to tell people to see if they have a slower, shallow breath by looking at their chest. You can still see a person breathe, even if they're wearing a lot of layers. You can also, if they are wearing a lot of layers, you can try to listen for a snoring or raspy breath. But those are the signs that you should look out for if a person is wearing a lot of layers, and if you think that if they are having an opioid overdose. Next slide, please. So how can you prevent a fatal overdose? So Narcan, also known as naloxone, is a medication to reverse an opioid overdose. Naloxone is not addictive. It is also not harmful to someone who is not overdosing on opioids and has no potential for misuse. So Illinois law covers any non-medical person to administer naloxone without criminal or civil liability. Individuals who seek emergency medical help for any overdose without risking criminal liability for possession is covered under the Good Samaritan law. So if I'm a person who is who wants to use Narcan on my friend, but I am in possession of a type of substance, I'm still covered by the Good Samaritan law because I sought emergency medical help and I was able to use Narcan on them. And also trained pharmacists are allowed to dispense naloxone through the standing order. So you are able to purchase naloxone over the counter now. So every pharmacy has Narcan available for you to purchase. There are multiple versions of naloxone out on the market. CDPH supplies the Narcan nasal spray. So you guys will be receiving the nasal spray version of naloxone during the pick count. Next slide, please. So these are the specific steps in order to prevent a fatal overdose. So the first thing that you want to do is call 911. And then you would open the Narcan box. Each Narcan box contains 2 of these nasal sprays. Each nasal spray also comes with instructions in the back here whenever you open it. So you would insert the nozzle into the nostril, creating a seal around the nose. I learned recently, you would want to angle the Narcan spray so that it doesn't go in straight into their sinuses. It goes into the opioid receptors if you angle it a little bit. You would want to hold the Narcan nasal spray like this, pictured in my video camera, if you're able to see it. You press the button fully and firmly, and then you'd stand back, wait 2 to 3 minutes for a medical person to arrive and stay on the scene until they arrive. After the 2 to 3 minutes after the first dose and they are still unresponsive, you're able to use a second dose of Narcan to help them. And if a person is unresponsive after the second dose of Narcan, you can still keep on using more Narcan. We've had cases, or we've heard stories where people have used multiple doses of Narcan in order to help the person breathe again. Next slide, please. So after you administer naloxone and you have that 2 to 3 minute time, 2 to 3 minutes, or that time period where you are waiting for emergency medical responders to arrive, you'd want to put them in the recovery position. And so you turn them on their right side and you'd want to support their hand with their head to make sure that their airway is clean or clear. Then you would want to put the knee over the body so that you can stop the stomach or stop your body rolling onto your stomach. I do want to note that using Narcan on a person who is overdosing If the person is very responsive to Narcan, they could be very confused, upset, agitated, or combative. It is very important to protect yourself first. So if you do plan on using Narcan, please be careful whenever you have to use it on a person, because they might not even remember overdosing at all. Next slide, please. So if a person is curious about where they're able to access Narcan for free, all Chicago public libraries carry Narcan. And that project started in January 2022. Next slide. You can also find Narcan in multiple locations around the city. So all mental health and CDPH mental health and STI clinics have Narcan, and select alderman offices have Narcan as well. The bit.ly link highlighted in red, if you copy and paste that link into your browser, you can find our Narcan or our harm reduction box closest to you. Next slide, please. So now for the next type of kit that you guys are distributing is our fentanyl test kits. They're very, very similar to our xylazine test kits. So we're only going over how to use fentanyl test kits today. But in our kit, you will find our step-by-step guide on how to use fentanyl or xylazine test kits. Specifically for our fentanyl test kits, we have a fentanyl fact sheet. Each kit has 5 fentanyl test strips, 5 ketchup cups, 5 stir sticks, and sterile water. Next slide, please. So these are the specific steps on how to use the fentanyl test strips. So you would open up the strip, you would take a very, very tiny amount of substance, usually half a grain of rice, the size of a half a grain of rice. You would dilute the substance with a shot of water, about 15 milliliters. You would mix the powder or substance into the water until it's completely dissolved. You would stick the end of the stick into the water for 10 to 15 minutes. You take the strip out, wait a minute, and then the results should be shown similar to the picture on the right. Next slide, please. Perfect. So I do want to give you guys this information as well. So the City of Chicago partnered with the Illinois Department of Public Health on this More Now program. So anyone who wants to join recovery is able to do so. You do not need any insurance. You do not need any documentation. This program will provide telephones for you. This program will also provide car rides to providers and pharmacies so that people are able to pick up their medications. This is a 24/7 hotline, so I can call at any time throughout the day, this number, in order to receive home induction to start treatment immediately. This is an Illinois helpline, so if people are looking for resources in the city or within the state of Illinois, they're able to do so through that line as well. I believe that is the end of my presentation. Oh yeah, so please let me know if you have any questions.
I know there's one question in here around how common it is with OD situations, which we can respond to in a moment. I will just say, well, thank you, Madeline, for doing this and coming to share a little bit more information on these resources. A lot. So we will have some language in your cheat sheet as well that can kind of be used for teams out in the field on how to kind of distribute these materials to unhoused folks that are interested. It can be a resource for them or a resource for friends or, relatives that they have. And so in the most of these cases, you will just be distributing the harm reduction supplies to unhoused folks that you see out on the night of the count. However, it's a best practice and important for all those who are engaging to be aware that these, we have these supplies. If there was an emergency situation that a team encountered an OD, as an example, you can always refer back to your homeless outreach team lead and provider, because you'll all be paired with outreach teams or outreach staff. And they are, have a lot of expertise and experience in administering Narcan and utilizing harm reduction supplies. So definitely I think they can be kind of the folks in the field helping to make those decisions. And just wanted to reiterate that that is something that you can all work with your teams and staff on. But if anyone else, how does one get Narcan? So Lauren, there is a slide on it and we can share out the slides with you, but I think there's other ways online, Madeline, as well. If you want to chime in,
Yeah,
pause.
so I know so you can access Narcan at any Chicago Public Library. So anyone in the public can go to the library and grab Narcan. You don't have to talk to the librarians. It's right before you enter the door to the library. If so CDPH is not mailing Narcan yet. We are looking into that. So I believe that you would have to go at Union, and all of the pharmacies also, you're able to purchase over-the-counter Narcan as well. So there's multiple ways that you can get Narcan. If you are looking to have Narcan for your organization, we highly suggest organizations to apply for the Drug Overdose Prevention Program with the state of Illinois. You can get Narcan shipped straight to your door completely free. It's a very great program.
Yeah, and I will say too, so with the harm reduction supplies, there's these little pamphlets of information. So like the MARS program, how, individuals can use the test strips and also administer Narcan are included in the supplies that you can give out. So that's something that you don't have to memorize, but if someone asks you a question about the harm reduction supplies that's being given out, you at least have a little context and background knowledge on some of these resources. And then for folks who were reading the chat, so I think Sarah put some helpful information around the OD question. So the information, of course, is just to make sure that everybody is informed about harm reduction supplies that you have and can distribute. If on the night of the count a situation is encountered, volunteers can look to their outreach counterparts, as we said, for what to do. There's no expectation for volunteers or people to do anything that they do not feel comfortable or safe doing. So I just want to reiterate that as well. And ODs are not common, but not impossible. And this is just to make sure that we're keeping everyone safe, including our unhoused neighbors. So. All right. And Erica, thank you for posting that resource as well. Thank you, Madeline, again for joining us. Some
Yeah.
resources here. If you want to stay on for more questions in the chat, that would be great.
Yeah, I can stay on.
Okay.
I can leave off with this. If you have any questions for the Office of Substance Use, our email is here. Any downloadable information we have on our overcomeopioids.org website, and all of our Chicago opioid and health data is on the Chicago Health Outlet. It's a really cool website. I highly suggest for you guys to check that out. And then the bit.ly to find Narcan near you is linked in there as well. Thank you for letting me be on this call.
Thank you. Okay. So we've shared a lot of information. We're getting closer towards the end of our training. So we still have, this is just to reiterate, like overview of the do's and don'ts during the night of the count. We'll get into some guidance specifically for CTA counting and then do small group breakouts and wrap up. So we're getting close to the finish line and we appreciate all of you being on here still. So just as a recap of what you should do during the count. So you want to explain to the folks that you're surveying why you're out there collecting the information and that their participation is voluntary, responses are anonymous. We'll have some of that language on the cheat sheets. You want to recognize that some individuals and just know that they may not always want to participate or engage, and that's totally okay. To complete the online survey, you want to try and do it with all of the individuals who are willing to consent and be surveyed. It should take about 10 minutes to complete each survey. And then for those that do not want to consent to doing the survey, you'll just complete that demographic information by observation, as we have shared. And then you'll want to give away supplies to all folks that you encounter, regardless of if they want to complete the survey or not. And then at the end of the unsheltered count, after you've gone through your assigned areas 2 times, you'll want to call your host site contact after you complete the count and let them know that you're finished and that you're heading out for the night. There were some questions in the chat around what to do at the end of the night to access public transit. Since you'll be in a car with other folks, I think that's something that we are encouraging folks to coordinate on how to get folks to a transit location that is a little bit more convenient if you have the car and can drop folks places, just because it will be late at night, and we encourage you to coordinate with your team on that. And then in terms of count don'ts, so please do not begin your count prior to 10 p.m. unless your site or teams are given permission. Do not add or omit questions while completing the survey. Please do not force anyone who does not want to complete the survey to complete it. They can skip questions and end the survey at any time. Between 10 and 12:30 a.m., this is something that we'll talk about in our small group discussion scenarios, but basically from 10 to 12:30 in the morning, we recommend that all individuals that are engaged at an encampment or in a tent, that you can, at a reasonable voice level in a respectful way, try and reach out and ask if anyone is in the tent and explain the situation that you're a volunteer, hoping to collect some information from them to better understand housing and service needs for unhoused and if they'd be willing to answer a few questions. And then if it's after 12:30 in the morning, just because we know that's getting a little bit late and some people might not want to engage and might be sleeping, we recommend that teams do not call out to individuals or folks in encampments if they're in a tent and trying to sleep. So if you see someone who's walking around in an encampment after that period of time, you can still try to engage them, but we want to be respectful of people in the time of night as well. So that was some guidance from our outreach providers that we wanted to include this year. And then, of course, don't wander off from your team. Always try to stay with your team. Do not, under any circumstances, take photos of anyone that you're interviewing or surveying. We want to be respectful of folks that you're encountering and engaging with on the night of, and don't climb over barriers or fences. Keep yourselves physically safe, and don't leave your car unattended and running. So kind of the main points. So there will be a small subset of volunteers that will be paired with the night ministry team at Forest Park Blue Line. So that's one of our terminus stops on the Blue Line that's close to the suburbs of Chicago. This is going to be important guidance for you around CTA counting, because the way in which that counting takes place is a little bit different from what other folks are doing in other unsheltered locations around the city. So from 10 p.m. to 12 a.m., if you're at the O'Hare Blue Line, Forest Park Blue Line, Howard Red Line, or 95th Red Line stops, this is mainly going to be outreach staff, as I said, but a few volunteers. You will be, during that 2-hour first window, completing the full survey and trying to get folks to engage in answering those questions. And then, of course, if they don't want to engage, just doing the demographic only questions by observation. You'll want to do that for folks that are exiting the trains at those terminus stops, as well as on the platform, in the station, past the turnstiles, around the stations outside as well. So you'll want to kind of circulate and try to get individuals in different locations around those stations. And then from 12 a.m. to 1:30 in the morning, by observation only, we have a special tally spreadsheet, like an Excel spreadsheet that you can print out, or we'll have printed out for you. And it will have specific demographic only questions, which I'll review momentarily, for folks that you'll be trying to tally and collect information about on each train. This year, we've increased this tally observation period by a half an hour, so it'll be an hour and a half, and that will just allow teams to capture more trains and get better, more reliable estimates in terms of folks riding all the trains the night of the count. So for that tally portion, from 12 to 1:30 in the morning, teams are not expected to ride the CTA trains to the next station. You're only supposed to get an observational based head count and tally based off of the different demographic info in that spreadsheet. We did add a run number variable in the spreadsheet, and you can also track the run numbers of the trains at that website. The train numbers are going to be in the upper corner of the window, so you can see the picture below. That's the run number, usually near where the operator of the train is. And if you are part of the team that is tallying, the person that's closest to the conductor's lead train, you'll want to make sure that you write down the run number in the appropriate rows for the clients that are engaged on the train or exiting the train during that period of time. Next slide, please. Thank you, Madeline. Take care. So for this additional tally period, like we said, this will, you usually encounter at least 2 to 4 trains, kind of depending on the time of night. So CTA has confirmed that trains at the terminus stations usually are at those terminus stations for about 15 to 20 minutes. So it's easiest usually to try and capture tally information as the train arrives before people start to move around. Our outreach teams are well versed in navigating the trains. So we will leave it up to your discretion to kind of decide, who's positioned where on the trains, and if you want your outreach staff teams to enter the trains or just stand at the front of the trains where the doors open to count people. But since the trains run every 15 minutes before midnight and then about every 20 to 30 minutes after midnight, that will give you a little bit of time to hopefully capture and tally everybody at those terminus stations. And then it'll be important for your small CTA teams at each hub location or at each terminal location to coordinate ahead of time. So you'll want to make sure that if you have a team of 5, as the little icon that Sarah graciously created at the bottom, you'll want to make sure that you have one person kind of lined up to handle 2 or 3 cars. And if you have, only 3 people on your team, you need to then account for the extra train segments that are like further to the back of the train. So just have a plan in place for the number of train cars each member of your team will be tallying on. And then the person at the front of the train, like the little diagram shows, you'll just want to record the train number and make sure the other team member individuals record that as well. So ideally, you'll want to make sure that you have at least 3 to 4 people who are helping to count on the trains. And you'll just want to try and collect the information, record it because it's going to be handwritten. So you want to make sure that you can record it legibly. And then in between trains coming and going, you'll want to transfer the tally information into the demographic only part of the survey. So because you didn't ask, you just skip for the consent question, you'd say no, and then you would enter the demographic info that you've collected by observation through the tallying. For most of the volunteers, this is a lot of information. You won't have to worry about it. The team that you'll be with out in the field, if you do count on CTA, it'll be like 5 volunteers at max. You'll have time to review this and coordinate, so don't worry about it too much, but it is just helpful knowledge for everyone to understand the different components and methodologies for the count. Okay. And then this is just what the CTA tally sheet looks like. It's been slightly updated this year, so you can write your name as the data collector if you're tallying and your CTA stop. There is drop-down functionality, but you're going to be printing these out, so I doubt you're going to have your computer out and drawing attention to it when you're doing this tally. But for gender identity and race, you can see that there's select all that apply. So if folks have multiple identities that they want to put, you should record both of those, of course, or if you can do that by observation, obviously that's a little bit limiting, especially for gender identity, but just try to do your best. And a lot of our CTA staff also know a good amount of the clients that ride the CTA continuously. So that should be helpful with this demographic info. Age will be age ranges based on what HUD mandates, and then you're going to identify if they are Hispanic or Latino. And then there's that CTA run number aspect as well that you can enter. Okay, so this is the part where we're going to stop talking at you for a bit, and we have actually pre-assigned breakout groups for everyone. We have some folks, both service providers from the night ministry team and also a seasoned volunteer from the veteran affairs team and our DFSS homeless services team members who are going to be facilitating these conversations with you. We will spend about 15 minutes in these groups, about 10 to 15 minutes in these groups, and it'll just be